Hi, my name is Stephanie Patton, and I'm the prevention coordinator for the town of Stoughton and the OASIS coordinator. I'm excited to share with you some of the key findings from the Stoughton Youth Health Survey of 2026. And today we're going to just talk briefly about how this data gets collected and what some of the processes are that we use to ensure that the data is of high quality. So we administered this survey in February, both at the high school and the middle school. We used SurveyMonkey, which is an electronic data collection tool. We did that intentionally so that the data was being collected outside of Google and the platforms that students typically use to support their feelings that this survey is anonymous and confidential. And I assure you that it is. That's very, very important to us. The survey itself is based on the Center for Disease Control's Youth Risk Behavior Survey, or the YRBS, which has been around for a very long time. It surveys adolescent health behaviors and attitudes across a number of domains. And so it's a very useful tool for us to be able to use to capture student health and some of the challenges related to that. At the high school, we were able to successfully survey 54% of the population, and at the middle school, 84%. And what that looks like when we think about valid surveys is that number that you see, the valid survey number, is after we account for students who were absent that day, students whose parents opted them out of the survey, which is an option. We do a passive consent process, which means parents are notified in advance that the survey is happening and they can choose to excuse their students from taking that instrument. We do remove surveys for when it looks like students are being inconsistent or not truthful on the survey. That does happen. It's certainly something we had asked about a lot. We do use some statistical processes. We work with an evaluator to identify which surveys are needing to be removed from the sample for inconsistency. It's pretty hard for students to lie in a way that is consistent. And so it does show up in the data, and we do pull those surveys out. And then, of course, there are some surveys that are basically just unaccounted for. And likely that means that the students themselves decided not to take the survey in the moment as they have the option to do. The surveys are not required of any student, so they also can opt themselves out during the survey. We work really hard to ensure that students both feel that the surveys are anonymous and confidential and that they, in fact, are anonymous and confidential. The purpose of these youth health surveys is to gather um, population level data so that we can have a sense for what's happening in the entire population. It's not to identify individual student behavior, it's really to think about, as we are addressing issues as a community, what those larger trends look like and where we should be paying attention. We do offer the survey in four languages. This is something that we started doing 2 years ago at our last survey administration. So the survey is offered in English, Spanish, Portuguese, and Haitian Creole. We know there are students that speak other languages. It's not perfect, but we really are trying to address as many linguistic needs as we can within reason. It is really important when you start to see the next videos where we explore the results of the data that we are thinking about how we balance both hope and concern. Lots and lots of positive findings from these surveys. Students really across the board are making really healthy choices. And there are things that we need to be paying attention to and that are areas of concern. And so the surveys really help us to focus our attention where we need to be thinking about putting our time and energy. The data itself provides lots of insight, not all the answers. It is a quantitative survey, which means that students have to choose from multiple choice answers. There is not a place or a way for us to really analyze open-ended questions. So often these surveys generate more questions, which is fantastic. And those are the kinds of conversations we want to encourage you to have with your student and wonder about why some of the results look the way they do and how students interpreted some of the questions. We also know that these issues that are identified through these surveys, the health issues, the emotional and mental health struggles and successes are things that are complicated. And although we survey in the school, that they are not the school's problems to solve, that we need to work collectively as a community to think about how we can support and help young people here in Stoughton. So I'm very excited to dive into the data with you. I hope you check out all of the videos in this series as we release them and learn a little bit about what we learned when we were reviewing and analyzing this year's Youth Health Survey.